I'm John Giever for MedPage Today at the American College of Gastroenterology meeting in Orlando. I'm here with Dr. Jean-Paul Achkar, Education Chair of the college, and I'm going to ask him about the top research presentations here at the meeting today. Dr. Achkar, tell me about the meeting so far. What's really struck you as being the highlights of the presentations so far?
Sure. Well, as you know, education drives everything the college does. The ACG annual meeting continues to be the premier GI clinical meeting. This year, as in previous years, we have multiple symposia and a lot of great science that's being presented. Highlights from the first day of the meeting include, from an inflammatory bowel disease standpoint, the first trial evaluating biologic therapy to prevent Crohn's disease postoperative recurrence. From colorectal cancer standpoint, we heard about tandem CT colonography and colonoscopy and attendant miss rates. And from an irritable bowel standpoint, we heard the results of a multi-center prospective trial regarding the yield of diagnostic testing in IBS patients, as well as we got a glimpse of the new IBS guidelines that will be coming out in January of 2009.
Sure. And I'd like to ask you a little bit about the guidelines. How important is it to have a revision of these? I understand they first came out in 2002.
Correct. So very important, because there's been a lot of advancements in this field during that time, and the new guidelines will be of great assistance to practicing clinicians in diagnosing, managing, and following their patients with irritable bowel.
And can I ask you also about the trial of the biologics and IBD? Why is that important? I know we have a number of these products out there now.
Sure. Well, the problem of postoperative recurrence in Crohn's disease is a particularly big one, and it's a field where there aren't many studies, and specifically biologics have not been evaluated for this particular problem. So today we did hear about the results of the first study looking at biologics, which suggested that biologics do have a role in prevention of postoperative recurrence.
And CT colonography, again, could you elaborate a little on why clinicians will find this important?
Well, and we will hear actually a lot more at this meeting about CT colonography, including a symposium that we have, but the exact role of CT colonography continues to be defined, and gastroenterologists hopefully will be able to help gastroenterologists figure out how to integrate CT colonography into their practice and what role it holds in relation to colonoscopy.
I'm John Giever, MedPage Today.